Our next guest is an outreach nurse with Niagara Region Public Health, and he's here to talk about sexual health for men. Scott dePass, I imagine it's a topic that many men find very difficult to discuss.
Women are more programmed to go and see their doctors for a lot of different things. They start out with doing birth control and seeing their doctor for different things going on. And men are typically not, because we don't have the same sort of concerns that we need to see a doctor for. So men typically go to see a doctor or to the sexual health if something is hurting or something's not working. So what we found in 2015 is we wanted to try and increase the number of men coming into the clinic for testing. We know that it's still a concern, it's just trying to get them in. And if you go to most of the clinics, it's run mostly by women. So if you are an older gentleman coming in to see some of our newer nurses, it's kind of like talking to your daughter, and it's very uncomfortable for them. And some of the younger ones talking to some of our more seasoned nurses, it's like talking to their mom. So we wanted to make sure that we had a clinic for men that was run by a male so that they could have a little bit more comfort coming in and see if that increased the number of people coming to the clinic.
I read that during COVID, there's been a sharp increase in the number of sexually transmitted infections. Why would that have been the case, Scott?
Unfortunately, we've also gone to a more digital age, so it's easier probably to dial up a relation than it is to get a pizza. So when you were closed for COVID, people still had access to a lot of the digital sources to be able to kind of meet people. And because of the way that the clinics were structured, we weren't able to have people in-house, or it was a lot more difficult to get tested. So we had a lot of people that were still out there having sexual contact with people, not necessarily getting tested because the ability wasn't there.
What is the most common sexually transmitted infection in Canada?
It's always, been the chlamydias and gonorrheas, which are passed on very easily. And about 50% of men and about 80% of women don't have any signs or symptoms. So it's a lot of times, if you don't have symptoms, a lot of people feel like, if I don't have anything, then I don't have anything that I need to worry about. And that's not always the case.
What are some of the symptoms that men should look for?
So, if you have any kind of burning during urination, any kind of discharge, sometimes it's more like sensitivity in the testicle area. It's the idea that if you have symptoms that are outside the ordinary for yourself, and they know their bodies better than anybody else, we want them to make sure that they're getting it looked at. So again, having a clinic where they can feel more comfortable means that they're more likely to get in and get tested.
Scott, you sort of alluded to it at the beginning of our talk that women are a little bit more comfortable talking about sexually transmitted infections and those kinds of things. And getting a checkup is part of their yearly routine. Why is it not such a comfortable thing for men to do the same thing?
It's one of the things that I try to educate when I have people in, is to say, if you're having more than one partner, not always necessarily using protection, every 3 months is a good idea, just to know for sure if you've come into contact with anything. And of course, if you have symptoms, we also encourage people to come in.
Scott, you've got a social media campaign right now, and one of the things you're trying to stress is that this is all really confidential, and they can talk to
Absolutely.
someone like you, another male,
Yes.
an outreach nurse.
That's correct.
Can you go into some of those details?
Well, when people sign up for the clinic, it comes directly to me, and I would reach out to them. And again, because it's I would typically kind of say, what is the easiest way for me to reach you, or the way that you want me to reach you? So it could be by phone, could be by email, could be by text. And so I reach out and I connect with each person and make arrangements to kind of meet them. I don't meet them in their homes. It's not a door-to-door service. But I try to figure out, if you are in St. Catharines, where's the closest place that I can meet you, so we can still have some discretion, but that I can meet you in a reasonable kind of place so that you can get the testing done.
Since you started the social media campaign, has there been an increase in men coming to the clinic?
It's still a fairly new, since COVID kind of started. It's only been up for about a month. So we're still waiting to kind of have that kind of check in, and the media campaign is there to try and make sure that people are more aware that we are now open and that we're doing business as usual now that COVID is starting to allow us to be able to kind of open things up like we did before.
Scott, where can people go to find more information?
If they want to give me a call, I can be reached at 905-401-4074, and it can be a call, it can be a text. They can also go on to the Niagara Region website and look for the men's health services, and they can sign up for the form that's in there, and it would, again, come directly to me, and I would follow up with them.
Scott, thank you so much for sharing this information today.